In next 20 minutes, I will help you learn about anxiety, its causes, types and symptoms, its effects on your brain and your body, and what are the best treatments. Let's turn information to knowledge and knowledge to wisdom. Join me on the journey to seek enlightenment and vanquish ignorance. What is anxiety? Anxiety is what we feel when we are worried, tense or afraid, particularly about things that are about to happen or which we think could happen in the future. Anxiety is a natural human response when we feel that we are under threat. It can be experienced through our thoughts, feelings, and physical sensations. Most people feel anxious at times. It's particularly common to experience some anxiety while coping with stressful events or changes, especially if they could have a big impact on our life. When is anxiety a mental health problem? Anxiety can become a mental health problem if it impacts your ability to live your life as fully as you want to. For example, it may be a problem if your feelings of anxiety are very strong or last for a long time. Your fears or worries are out of proportion to the situation. You regularly experience symptoms of anxiety, which could include panic attacks. You find it hard to go about your everyday life or do things you enjoy. You avoid situations that might cause you to feel anxious. Your worries feel very distressing or hard to control. It is also possible to experience problems with anxiety without having a specific diagnosis. The diagnosis of anxiety disorder depends upon your symptoms. What are anxiety disorders? Anxiety can be experienced in a lot of different ways. If your experiences may contain certain criteria, your doctor might diagnose with a specific anxiety disorder. Some commonly diagnosed anxiety disorders are, we can say the first one, generalized anxiety disorder. As a short, we call it GAD. This means having irregular or uncontrollable worries about many different things in your everyday life, as there are lots of possible symptoms of anxiety. This can be quite a broad diagnosis, so the problems you experience with GAD might be quite different from another person's experiences. Secondly, another one is called social anxiety disorder. This diagnosis means you experience extreme fear or anxiety triggered by social situations where you have to talk to other people or in front of audience, such as public gathering, work presentations, or everyday situations. It is also known as social phobia. At number 3 is panic disorder. This means having regular or frequent panic attacks without a clear cause or trigger. Experiencing panic disorder can mean that you feel constantly afraid of having another panic attack, to the point that this fear itself can trigger your panic attacks. At number 4 is phobias. A phobia is an extreme fear or anxiety triggered by a particular situation, such as going out to meet people or a particular object or animal, such as spiders, birds, or rodents. At number 5 is post-traumatic stress disorder. As a short, we call it PTSD. This is a diagnosis you may be given if you develop anxiety problems after going through something you find traumatic. PTSD can involve experiencing flashbacks or nightmares, which can feel like you are reliving all the fear and anxiety you experienced at the time of the traumatic events. Number 6 is obsessive compulsive disorders. As a short, we call it OCD. You may be given this diagnosis if your anxiety problems involve having repetitive thoughts, behavior, or urges. At number 7 is, for some people, is health anxiety. This means you experience obsessions and compulsions relating to illness, including researching symptoms or checking to see if you have them. It is also related to OCD. At number 8 is body dysmorphic disorder. As a short, is BDD. This means you experience obsessions and compulsions relating to your physical appearance. Number 9 is perinatal anxiety or perinatal OCD. Some mothers develop anxiety problems during pregnancy or in the first year after giving birth. So what are the symptoms of anxiety? The symptoms are anxiety feels different for everyone. You might experience some of the physical and mental effects, as well as effects in other areas of your life. Sleep and circadian rhythm disruption is a common feature in many psychiatric disorders, including depression and anxiety. Stress hormones such as cortisol plays a key modulatory role in sleep. Elevated cortisol levels can therefore interfere with the sleep. Some of the effects of anxiety on your body can include headaches, backaches, or other aches and pains, faster breathing, a churning feeling in your stomach, feeling lightheaded or dizziness, sleep problems. Some people do grinding teeth, especially at night, pins and needles, feeling restless or unable to sit still, a fast thumping or irregular heartbeat, sweating or hot flushes, nausea, that's like feeling sick, needing the toilet more often or less than often, changes in your intimate life, or having panic attacks. After effects of anxiety on your body, let's look at the effects of anxiety on your brain. The first one is when you feel anxious, your body goes on alert, prompting your brain to prepare itself for flight or fight mode. In an attempt to help you fight off whatever has made you anxious, your brain floods your central nervous system with adrenaline and cortisol. These hormones tell your body that something scary is about to happen. Their role is to help you cope with danger. In order to do that, they sharpen your senses and make your reflexes faster. In a non-anxious brain, when the danger is gone, the sympathetic part of your nervous system takes over and calms you down. But when you suffer from anxiety, you may not be able to reach that sense of calm. Instead, the rush of stress hormones causing your brain to release even more stress hormones until you are simply overwhelmed. When excess amounts of stress hormones flood the brain over and over again, your baseline level of anxiety may increase. You might go from having mild anxiety, which most of us experience on a day-to-day basis, to moderate anxiety. Moderate anxiety is slightly more severe and overwhelming and makes you feel nervous and agitated on a regular basis. If your brain continues to be overly sensitive to anxiety, your baseline anxiety level might become so severe that you are unable to continue thinking rationally. Panic attacks are another sign of severe anxiety. The second effect of anxiety on brain can be hyperactive to threats. When you deal with anxiety on a constant basis, your amygdala grows larger. The amygdala is a tiny almond-like structure located in the limbic system, the part of your brain that deals with emotions and moods. The amygdala is like your brain's watchman, staying on the lookout for any danger or threats. When the amygdala notices potential danger, it sends signals to the hypothalamus, which triggers a fight or flight response. In the anxious brain, the amygdala is large and hypersensitive. Because of this, the amygdala sends a lot of false alarms. You can think of a hypersensitive amygdala as a watchman who cries wolf too often. An overactive amygdala sends false alarms so often that your brain senses threats even in non-threatening situations. That's why people with anxiety disorder tend to feel threatened more often than someone without such a disorder. Number 3, the anxiety weakens the connections between amygdala and the prefrontal cortex. When the amygdala alerts the brain to danger, the prefrontal cortex should kick in and help you come up with a rational and logical response. The prefrontal cortex ensures that you are capable of processing information analytically and can make informed decisions, as well as helping you solve problems. You can think of the prefrontal cortex as your brain's wise counselor. In non-anxious brains, the prefrontal cortex responds rationally. When the amygdala sounds out alerts, this process doesn't work the same in anxious brains. Instead, when the amygdala alerts the prefrontal cortex to danger, the connection is weak. Thus, the rational problem-solving part of the brain isn't heard, which can lead to irrational thoughts and erratic behavior. Number four, when you are anxious, your body is under a lot of stress. Stress shrinks the hippocampus, the part of the brain that processes long-term and contextual memory. When the hippocampus shrinks, it may become more difficult for your brain to hold on to memories. But here is the tricky part. Canny anxiety tricks the hippocampus into thinking that memories related to anxiety are safe to store and remember. So the few memories you hold on to will be those related to anxiety. In other words, anxiety wires your brain to remember failure, threat, and danger. Happier memories like those of success, achievement, and safety are buried deep in your brain's basement. If you want to know more about brain anatomy and the parts of the brain I just mentioned, amygdala, hippocampus, prefrontal cortex, there's a link in the description or somewhere on the screen. You can click it and watch my video on brain anatomy and its function. Let's move on. Let's look at effects of anxiety on your mind. Milder effects: feeling tense, nervous, or unable to relax, having a sense of dread or fearing the worst, feeling like the world is speeding up, slowing down, feeling like other people can see you are anxious and are looking at you, feeling like you can't stop worrying or that bad things will happen if you stop worrying, wanting lots of reassurance from other people or worrying that people are angry or upset with you. B. Extreme effects: low mood and depression, worrying about anxiety itself. For example, worrying about when panic attacks might happen, worrying that you are losing touch with reality. Rumination, thinking a lot about bad experiences or thinking over a situation again and again. Depersonalization, a type of disassociation where you feel disconnected from your mind or body, or like you are a character that you are watching in a film. Derealization, another type of disassociation where you feel disconnected from the world around you, or like the world isn't real, worrying a lot about things that might happen in the future. So how to deal with the situation when an event is over? I mean, after a panic attack. Think about self-care. It's important to pay attention to what your body needs after you have had a panic attack. For example, you might need to rest somewhere quietly or think just eating or drinking something. You might need some rest to get over the trauma you just had. It is very helpful to tell someone that you have had a panic attack, someone you trust, obviously. It could be particularly helpful to mention in case you have one in future and how you would like them to help you. If they don't know, it might cause a panic for them by looking at your state. Let's look at the reason what causes anxiety. Everyone's experience of anxiety is different, so it's hard to know exactly what causes anxiety problems. There are probably lots of factors involved. Number one, past or childhood experiences. Difficult experiences in different phases of life are a common trigger of anxiety. Going through stress and trauma when you are very young is likely to have a particular big impact. Experiences which can trigger anxiety problems include things like physical or emotional abuse, neglect, losing a parent, being bullied, or being socially excluded. Secondly, your current life situation. Current problems in your life can also trigger anxiety. These are divided into two parts. A, state of mind, which is exhaustion or buildup of stress, lots of changes or uncertainty, feeling under pressure while studying or at work, worrying about the environment or natural disasters, also called climate anxiety or eco-anxiety, feeling lonely or isolated. B, circumstances, like long working hours, being out of work, money problems, having housing problems or homelessness, periods of bereavement after losing someone close to you. It varies from person to person. Some people live in that state for a day or so and come out of it, while others, it can last for weeks, months, or even years. Other is being abused, bullied or harassed. Big chances to someone's day-to-day life can be particular trigger for anxiety. Many people experience anxiety problems during the coronavirus pandemic after changes in their lifestyle. They feel stuck in their home and couldn't go out to see their friends and families. At number 3 is physical or mental health problems. Other health problems can sometimes cause anxiety or might make it worse. For example, if we talk about physical health problems, these might be due to living with a serious, ongoing, or life-threatening physical health problem. For mental health, it's common to develop anxiety while living a stressful lifestyle or living with depression. At number 4 is drugs and medication. Anxiety can sometimes be a side effect of taking some psychiatric medications, some medications for physical health problems, recreational drugs, and alcohol. So what is the treatment? Number 1, it can be talking to someone you trust. Talking to someone you trust about what's making you anxious could be a relief. It may be that just having someone listen to you and show they care can help in itself. Number 2, keep your anxiety under control. Anxiety can make it really hard to stop worrying. You might have worries that are really out of your control. There are people out there who believe if they don't worry about a particular problem, it will not be solved. Or if they don't worry about someone, bad things might happen to that person. So how to deal with that situation? Put some time in the diary or calendar to focus on your worries, but it needs to be timed. The amount of time you spend thinking about the issue should not be prolonged that it sucks you into the anxiety spiral. The other method is to write down your worries and keep in a diary, and not to think about until you get a chance to deal with them. Try reassuring yourself that I will read the diary and deal with them when I get a chance, but it can wait for now. These 2 methods really help some people. Number 3, look after your physical health. Try to get enough sleep. Sleep can give you the energy to cope with difficult feelings and experiences. Think about your diet. Eating regularly and keeping your blood sugar stable can make a difference to your mood and energy levels. Try to do some physical activity. Exercise can be really helpful for your mental well-being. Number 4, try breathing exercises. Breathing exercises are helpful to feel more in control. If you're sitting or standing, place both feet flat on the ground. Whatever position you are in, place your feet roughly hip width apart. Let your breath flow as deep into your belly as is comfortable, without forcing it. Try breathing in through your nose and out through your mouth. Breathe in gently and regularly. Try to count up to 5 while breathing in. If you can, then without pausing or holding onto your breath, let it flow out gently, counting up to 5 again. If you find this helpful, keep doing this for around, let's say, 5 minutes. Number 5, mindfulness. Can mindfulness help with anxiety? Mindfulness is a way of giving your full attention to the present moment. Some people find mindfulness helpful for coping with certain anxiety disorders, but others say it makes them feel worse. One of the reasons is that they feel their negative thoughts are too intense and it can make them feel worse. If you try mindfulness and still feel unwell, try to contact a therapist about other things you can try. Number 6, keep a diary. It might help to make a note of what happens when you get anxious or have a panic attack. This could help you spot patterns in what triggers these experiences for you, or notice early signs that they are beginning to happen. You could also make a note of what's going well. Living with anxiety can mean you think a lot about things that worry you or are hard to do. It's important to be kind to yourself and notice the good things more and often. Number 7, therapies. There are many types of therapies that you can try to see what works for you best. Number 1, yoga. Number 2, meditation. Number 3, aromatherapy. Number 4, massage. Number 5, reflexology. Number 6, herbal treatment. Number 7, hypnotherapy. And number 8, CBT and ART. CBT is cognitive behavioral therapy. This focuses on how your thoughts, beliefs, and attitudes affects your feelings and behavior and teaches you coping skills for dealing with different problems. ART is applied relaxation therapy. This involves learning how to relax your muscles in situations where you normally experience anxiety. If you're a family member or friend of someone who suffers from anxiety, how you can help? First of all, don't pressurize them. Try not to put pressure or push too much on your friend or family member to do more than they feel comfortable with. It's really important to be patient, listen to their wishes, and take things at a pace that feels okay for them. Although you are trying to help them face the fears or find practical solutions, but it can be very distressing for someone to feel they are being forced into situations, as they might not take it the right way and become reluctant to get your help. This could make matters even worse, where they are on their own and anxiety gets worse. Ask how you can help. Another way of helping them is to ask your friend or family member how you can support them. For example, helping them with difficult situations, talking to them calmly, or doing breathing exercises with them. By asking them what they need or how you can help, you can support them to feel more in control themselves. Some people don't want any support, but only the presence of a family member or a friend. It helps them feel safer and calmer. If you like this video, please like, subscribe, and share. Also leave a comment down below to let me know what do you think of this video. Thank you.